Prynhawn da bawb. Fel Albert y bore yma, dwi'n mynd i ddechrau yn y Gymraeg,
as usual,
a wedyn newid I
kick off in
Saesneg.
Welsh and then switch to English.
Just aros.
So we'll just wait for everyone to put their headsets on and that everybody can hear me.
Felly.
So, I'll start in Welsh
Diolch
and
am y
then
gwahoddiad
continue in
am yr
English.
i'r cynhadledd.
Thanks very much for the invitation to come to the conference. It is an honour.
Mae'n anrydedd
It's
bod
an
yma fel
honour to
Comisiynydd
be
Plant Newydd
as the
Cymru.
new Children's Commissioner for
Dyma'r
Wales.
hyn rwy'n gobeithio trafod gyda chi
This is
heddiw.
what I hope to talk about today.
Dwi'n mynd I ddechrau
I'm going to
drwy
start
egluro'n fras
by
fy rôl
explaining very
fel
briefly
Comisiynydd
my
Plant.
role as
A
the
rannu
Children's
tipyn
Commissioner.
am fy
And I also want to share with you
cynlluniau.
a little bit about my plans for
Mi
the
fydd
future.
prif ran fy araith yn
The main
trafod
part
deddf
of my speech will look at
gwasanaethau
the
cymdeithasol
Social
a
Services
Llesiant
and
Cymru
Wellbeing Act
ar ôl hawliau plant yng
and
Nghymru
looking at the
wrth i ni
rights of
fynd ati
children in
I
Wales as we
weithredu'r
go
deddf.
about to try and implement the Act.
Fe wna I gloi drwy
And
drafod
then
lle
I will
rydyn ni wedi
conclude
cyrraedd
by
gyda
looking
hawliau
at where
plant yng
we've
Nghymru
already reached with
a
children's
roi
rights in
blas
Wales.
o'r hyn
And
fydd
then
yn cael ei
to
gynnwys
give you a
mewn
taste
adroddiad
of what
dwi'n
will be
cyhoeddi wythnos
presented in a
nesaf
report that
i'r
I will issue
cenhedloedd
next week
unedig
for the
gyda
United
3
Nations
Comisiynydd Plant arall
with the other
Prydain.
3 Children's Commissioners of Wales and England and Scotland.
So,
In English?
I'm going to start by asking the question that might be in your heads as well at the moment. What is a Children's Commissioner for? I'm the 3rd Children's Commissioner. The other 2 are up there. And 14 years after the post was established, I think it is a good time to stop and ask that question. I asked that question to a group of primary school children the other day. What is a Children's Commissioner? And a 6-year-old went, I know. My head teacher told us, your job is to keep us safe from strangers. And I felt a real weight of responsibility with that. I see myself as having a number of roles, really. Of course, the UN Convention on the Rights of the Child is central to everything that I do. I plan to be a listener and an advocate for all children and young people, and especially those who need extra help in bringing their issues to the fore. And of course, particularly those children and young people that all of you serve in your everyday work. It's part of my role to investigate and research important issues, and where necessary, to use my legal powers to do so. I expect to influence policy and legislation, hopefully before it's finalised rather than just critique it afterwards. Because I don't have to concern myself just with one part of the sector, as most people do who are delivering things, I'm not just about social services, I'm not just about education, I'm not just about transport. I think my role gives a really good opportunity to spot the gaps and the connections in what we as a society and we as public services have to offer for children and what children's experiences are. So I see that as another important role for me. It wouldn't surprise you to hear that with my university background, I personally see my role as being about promoting an evidence-based approach to all that we do in public services in delivering for children and young people. And I think I need to bring the experiences of children and young people to everyone's attention and help them, be a direct voice for them as well. You know, advocacy is very important to my role. Well, for myself, being an advocate is also important. I was on a school visit in Llandudno yesterday during Karen McCluskey's speech, so I wasn't here for it. I feel as if I was here because I've heard so much about it. Actually, so many people have told me how powerful it was. I feel like as if I was here to hear that young man's story firsthand, and I know all about his story now from all of you and your enthusiasm. It just really shows the power of stories and how important it is to bring people's everyday experiences to the fore. And there's been a lot of really good stories in these last 2 days. My predecessors and the team have raised many issues relating to children's social care over the last 14 years, and many of you will have had contact with my office to discuss specific cases. and thank you for your cooperation on those. We nearly always seem to get them resolved really quickly once we start talking about them. And you'll have seen thematic reviews published on issues like advocacy, services for care leavers, and respite care services, to name just a few. My office also spends much of its time doing what Mike Shooter, in his review of the office last year, called upstreaming, or what we prefer to call influencing. Largely invisible work, actually, but spending time with people like Welsh Government and other providers like yourselves and the NHS, and discussing policy as it's being formulated, and suggesting areas that should be being looked at that aren't being looked at. So, in fact, the Welsh Government published a compliance report just a couple of days ago on the Children and Young People's Rights Measure, and they acknowledged how my office, before my time, influenced the Active Travel Act to make sure that it paid more attention to children and young people and their experiences with travel. So, what am I going to be doing first of all? Well, this year one of my main priorities is going to be residential care, and that's very timely with some things that have been in the news today. And I'll be working with the Care Council, CSSIW and others on that to make sure that we really have a good look at the experiences of children and young people in residential care in Wales this year. I'll be monitoring the government's progress and other service deliverers' progress on CAMS and on advocacy. I'll be continuing the work started by my predecessor on child sex exploitation. I chair a national group which is really trying to make sure that we have a strong national response to child sexual exploitation. And I'll be continuing our bread and butter work of individual casework, of course, and our participation work programmes with children, and responding to policy reviews. And like many of you, we're sort of engrossed in reading the second tranche of codes and regulations on the Act and thinking about how to respond to them. But a really important part of what I'm doing this year is saying, okay, I'm here for the long game. I've got 7 years. I'm not going to say on the first day, this is what I'm going to achieve, or this is what I'm here to do. I'm going to take time to listen to other people. I don't think I can do this job on my own. So we have already got stuck into a consultation strategy we're calling What Next, or Beth Nesav. And this conference for me is part of that. What I've been doing and will continue to do is have hundreds of conversations with children and young people, people who care for them and people who care about them, and I know that includes everyone in this room. So I've got a favour to ask of you all. As you listen to this speech, could you jot down any thoughts that you might have about what you think my priorities should be over the next 7 years, the kind of issues you would like to see me tackling, how you think I can be most effective, and what you would like to see me having achieved at the end of the 7 years. We've put some cards on the table. There weren't quite enough to go round. It was a bigger conference than we'd realised, so well done the organisers on that. But there's lots of paper around, and come up and say hello to me afterwards and give me your bit of paper, or to Howell, my public affairs person, who is there. See the hand in there. And the results will go with all the hundreds of other results in this part of the consultation. This is the depth bit, the qualitative bit. It's being systematically analysed. And after that, we'll have to get the breadth. We'll be launching a survey in September where we hope to have thousands of responses to help me formulate my priorities. It will not only help me understand what my priorities are, I think it will give us a good sense in 2015 what the nation's priorities should be for children and young people. And I'll have plenty to say as the parties formulate their manifestos for the next election. So, to move on to the main body of what I want to talk about, the Act. And that's sort of my main question, really. How does Wales articulate its vision for children under the Act? There have been many debates over the last few years about the people model in Wales, and my predecessor, Keith, expressed a number of concerns about the potential losses to child-centred services under this model. However, as we're often reminded by Margaret Provis, the Act is a fact, And I want to move on from that discussion today to think about specific opportunities and challenges ahead for children's social services as we move on to implementation from next April. I think a lot of what I'm going to talk about is equally relevant to adult services, so I hope that those of you for whom that's your primary responsibility will also find this of use. Beyond that general question, a more specific question for you, I think you're mainly providers here of social work and social care services. How do you expect the experience of children and young people who are in need of care, support or protection to change from next April onwards? What will it feel like to be a child or young person receiving services under the Act as opposed to receiving them now? Although I think the Act provides exciting possibilities, which I'm going to talk about now, as well as challenges, I can't quite yet see with any specificity how being a child in contact with social services will change or stay the same. Although actually over the last couple of days I have begun to get a bit of a flavour of some real excitement over it from those of you who are providing the services, not just anxiety or nervousness about this very big change. For me, I think the key challenge is keeping children's rights central. The United Nations Convention on the Rights of the Child is on the face of the Act, as most of you will know. Disappointingly for me, it's not on the face of the sister legislation, the Regulation Inspection Bill. It's welcome for me that it's on the face of the Act because it places a duty on you as service providers under the Act, not just on government ministers, which is what the measure does. But what's that going to mean in practice? Is it just symbolic, placing it on the Act, or what will it mean for children and young people's experiences? I think that some of the core principles underpinning the Act and some of the detail within the Act could, if implemented properly, help bring children's rights absolutely to the centre of what we do. So I'm going to talk now about what I think citizen-centred practice might mean when applied to children, and then move on to talk more briefly about preventative services, joined-up planning. We've heard a lot about that the last couple of days. Outcomes, delivering better outcomes for children, and transitions to adulthood, which is also a key interest of mine. So, a citizen-centred approach must mean an approach that includes children as citizens. I'm not suggesting that children's needs can be separated out from the adults around them, but I think for too long, at least since the last Act that produced this kind of change, in other words, the 1989 Act, when we've been doing social work with children, we've claimed to be child-centred, when in fact a lot of what we've done has been centred around the adults around them. So a child-centred and a child-citizen-centred approach must mean practices that involve children in making decisions, provide choice where possible, and engage children meaningfully in assessing their needs and making plans. Just before I left the university, I was conducting a research project we called the TLC project, the Talking and Listening to Children project. We observed social workers talking and listening to children in nearly 100 meetings and visits across all 4 nations. So some of the fieldwork was conducted in Wales. In the most successful visits, children and social workers understood, so both the children and the social workers understood and accepted the purpose of the meeting, which was in itself purposeful. The social workers made specific space to talk to children, whether that was in another place outside of the home or within the home in a separate room, or even sometimes carving out a corner of the sofa to have a proper conversation that showed an interest in children and young people beyond how are you, how is school today. And they used direct play, exercises or sustained conversation. So those were the really good examples we saw, and we saw those in every country, including in Wales, of course. Yet due to the process-driven nature of much children's social work as it has evolved over the last 20 or so years, it's also possible to observe children being counted as having been seen, and they have to be seen, because they were spotted during a school visit to another child. We saw that on more than one occasion. We saw descriptions of children in core assessments that had been copied and pasted from the description of a totally different child from a totally different family. This is due to high caseloads, yes, but also to a system that's driven by measurement of outputs rather than outcomes for children. I've been really encouraged over the last 2 days about how much I've heard about relationships in this conference. And I really hope that under the Act we really will bring relationships back to the core of what social work is. We know that children and young people value time with their social workers and ongoing relationships, a genuineness and a sense there's someone who cares about what happens to them and is interested in their everyday life. So a citizen-centred approach for children may mean rethinking the design of services, where at the moment children and their families may be moved along a line of relationships with social workers, sometimes due to changeover of staff, but also due to how we have this specialised organisation of services, from intake through to referral to a range of in-house and other service providers. A citizen-centred approach for children may mean rethinking review meetings for looked after children and children in need, so they become spaces where children and young people feel they have genuinely some choice and control, and not places where too often they feel they don't want to speak or they don't want to be. A citizen-centred approach for children should mean a genuine desire to include children and young people in providing feedback on our services and planning new services. To be honest, in many ways, social services have got a lot to teach other providers on that score. And lots of local authorities for many years have had involved children in recruiting staff, in providing feedback through looked after children forums. And I know that there are thriving child and young people safeguarding boards in many areas. They're just a few examples of practice. And here's a good example of a local authority listening to children. So my office was following up one of our pieces of work called Lost After Care, and wrote, many of you will have had these letters in the past from our office, wrote to the local authorities asking about their response to our report. This local authority explained to us how they had engaged children and young people in producing their response to us. They made up a response. Didn't make it up, I hope. They formulated their response, and they shared it with children and young people to say, does this actually reflect for you the reality on the ground? And the bits that they said didn't, they made a plan to actually change the services in the future. So they didn't only show they were prepared to listen to children, but actually to act and change things. But there are plenty of examples of how children and young people's involvement is cursory or non-existent. Since I started this post, I've met young people from several local authorities who feel powerless in the face of cuts to support services and youth services. And they say to me, what can we do? And we give them advice on how to make representations. Some local authorities are really good at communicating decision-making processes and genuinely involving citizens of all ages in planning services. But I think too often this consultation and involvement can be really adult-centric, even when ostensibly consulting about services for children. I'm going to read you out an example of a consultation letter. I'm not going to read it all, it's far too long. I'm not going to name the authority, of course. But here's an example of how not to do it. Okay, this came out only last week, so I'm not bringing up something from the dim and distant past. Okay, it was personally addressed to teenagers in a local authority who would be likely affected by proposed cuts to a bus service. It takes quite a lot of reading to understand actually what it is about. So the child has it through the post. It's personally named to them. And I'm just going to show you how it starts. And if you don't sort of fall asleep within about 30 seconds, you've got a better attention span than I have. So dear consultee, proposed changes to the council post-16 transport policy. In accordance with the Learner Traveller (Wales Measure 2008, the Council is consulting on proposed changes to home-to-school transport policy for pupils/students aged 16 to 19 years. The Council has a statutory duty to provide home-to-school transport for eligible children up to the age of 16. There's no legal requirement to provide free transport to pupils or students over the 16 years. However, Section 6 of the Learner Traveller Wales Measure 2008 gives the Council the power to make discretionary travel arrangements for people or students aged 16 to 19 who would not otherwise qualify for free home-to-school transport. And so it goes on for 2 really closely written pages. Incidentally, it was personally addressed in English to all children in the local authority, whether they were Welsh speakers or not, and there was a non-personally addressed photocopy of a Welsh translation tucked in behind. But that's for the Welsh Language Commissioner maybe to pick up, but it's another issue. And so it goes on, and eventually it ends with, at the end of page 2, the consultation will take place between Monday the 8th of June 2015 and Friday the 24th of July 2015. During this time, we would like to hear your views. You can take part by either, and there's a long list of ways that you can write in, etc. During this time, we would like to hear your views. Actually, I don't think they do want to hear their views. I think they're trying to bury this consultation and tick a box that the young people have been consulted with. That was not a social services consultation. As you can tell, it was from a transport department. But it just shows that, some of the good practice that we've seen has not spread out right across public services. If we want children and young people to play a genuine part in our services, we need to make sure that it's a genuine offer for consultation, not just because we have a requirement to do it. Social workers and other social services staff need to develop excellent skills in enabling children and young people to have choice and control in the planning of services to meet their needs. Clearly, some children will need help in expressing their views by someone who's independent of their social worker, perhaps if they wish to challenge or complain about a social services decision. And you'll be aware of the work that my predecessor carried out to ensure that advocacy was consistently available to those entitled to it throughout Wales. That persistence seems to be paying off, and I think we're inching towards a national approach to advocacy for children. And I will continue to monitor progress on this until children and young people who use services are consistently reporting that they know that advocates are available to them if needed, and that the service, if needed, is a good one. We seem to be achieving good progress with the National Adoption Service, and I hope that a national model for advocacy may be able to drive consistency and quality in the same way. I think in all our discussions about service organisation, it's always worth pausing to consider what it might feel like to be a child or an adult service user indeed entering the social care system. A child that comes into contact with social services won't know the name of the team or the service they're interfacing with necessarily. They won't know whether it's under the Social Services and Wellbeing Act or the Children's Act 1989. They won't know if it's the intake team, the MASH, or the care and support service. That child will mainly just want reassurances and someone to help them and hear them at a time when they're likely to be frightened and confused. Last Friday, I met a girl who spent about half her life in foster care. She's now a university student, and she was just remembering to me what it felt like when she first came into care, and she'd just been bereaved. She just lost a parent, so she was frightened and confused. She said, I was so scared about what it would be like going into a foster home. I really couldn't imagine what it would be like going to live in someone else's home. She was living in a predominantly English-speaking area, but was in a Welsh medium school, and she said, do you know, it made such a difference as a social worker noticed that I could speak Welsh, and every now and again in those big meetings they had when they were trying to decide what to do with me, she would just say to me, Ti'n okay? Did you make maths? And, you okay? Do you want to go out? And she said, it was just like our special little thing we had between us, and it just made me feel that she cared about me and she looked after me. And she had that social worker for 7 years, which was just fantastic to hear, and had an ongoing relationship with her. So to sum up on citizen-centred work and participation, many of you will know Dave Middleton, who retired from Welsh Government about a year ago and was quite involved, I think, in some of the early work on the Act. And I had a chat with him recently, and he made this point to me: how can we expect citizens of Wales to co-produce services with us if they've not had experience of participating as citizens from an early age? He was just reminding me really that the two concepts of participation and co-production are really intertwined, and we can't expect good co-production unless people have had genuine opportunities to participate from childhood. Keeping children's rights at the core will also be achieved if early intervention and prevention, as emphasised in the Act, can be fulfilled. Everyone here will know the disparity in rates of looked after children between Wales and the rest of the UK. If you want to see a good graph that shows it really graphically, look at Martin Elliott's research poster out there in the corridor, because it shows really well how things have changed. What none of us know for sure is why the numbers are so much higher, but we do know some of the ways that we can prevent the need to remove children from their families. And when we do good prevention, then we are fulfilling, of course, some core children's rights, the rights to family life, the rights to have provision of all the services they need to grow up happy, healthy, and to fulfill their ambitions. In Wales, we've got some really strong early intervention and prevention programmes for children and families, including Flying Start and Families First, of course. What I find absolutely baffling is that in Welsh Government, these are planned and funded in a completely separate department from Children's Social Services. And yet much of the work being carried out in those programmes is what you or I would call social work. And they're often actually serving the same families. Okay. And I have raised this with every minister and senior civil servant I've spoken to. While some local authorities are clearly achieving excellent join-up across the whole spectrum of children's services, and the accolades were really inspiring this morning, actually, and some of the other examples we've heard today, it's not clear in every local authority. I think there's probably some lessons to be learned from the models of service in Families First, such as joint commissioning and planning across education, health and the third sector, commissioning by children and young people, which we've seen in some of the Families First services, the team around the family approach, and restorative approaches that could be more fully utilised perhaps in statutory services. This sort of join-up needs to be led at a national level. And I really want to see more join-up in Welsh Government in policy making for children across departments, so that children are viewed holistically, not just in terms of specific service needs or levels of concern. Duncan Forbes yesterday, who's speaking at the end of the day, vividly gave examples of 10 different sets of assessments and preventative services for children. It's just not sensible, actually, in these times when we need to be all pulling together to deliver good services for children. Perhaps with a slight shake-up that's going on in Welsh Government just now, we've got the opportunity to actually put children holistically at the centre of Welsh Government. And this approach, of course, needs to be replicated in local authority areas with joint commissioning and planning across health, education, social services and the anti-poverty programmes. There'll be new opportunities for comprehensive joined-up planning under the Future Generations Act, of course, and I'll be watching carefully to see how or if the new public services boards keep children central in their planning and delivery. It was really encouraging to hear the Director of Wrexham yesterday talking really positively about how all this new legislation is a challenge to be embraced alongside the citizens of her area. I suppose my question for you is, how will local joined-up planning be affected by the upheaval to come with the reorganisation of local authorities? How can we drive consistency and quality of services with the complex footprints we've got of regional delivery? How can we keep delivery for children coherent across the new local authority map the differing footprints of regional safeguarding boards, adoption consortia, health boards, and education regional consortia. Having seen all of you at work in the last 2 days, I feel confident that you're going to work hard to make that happen. But there are challenges ahead, of course, around how we organise our regional delivery. Children most at risk of separation will usually require a joined-up, concerted and multifaceted intervention. I emphasise the word intervention because there's a risk that in statutory services, social workers have become mainly assessors and referrers on, with little direct provision from themselves. While social workers won't be able to provide all of what a family with complex needs, and they will need to draw more than one source, there's an irony that some of our most skilled work, like direct work with children and teaching parenting skills, is actually often being carried out by social care and support staff rather than by qualified social workers. I welcome the emphasising the Act on outcomes, and this may go some way to encouraging statutory social work to refocus towards intervention and providing help, an old-fashioned word, but a good one, I think. We do need an evidence base for our interventions and service models so that we can have some confidence that all of our considerable efforts to improve the lives of children and others who use services are actually having a positive impact. Which brings me on to talk about outcomes. Does social work make a difference? It's something that I thought a lot about. It's a yes over there from Basworth. Something I thought a lot about in my previous job, of course. Does social work make a difference? The answer from an evidence-based point of view is that we know much more about specific programmes, such as the Strengthening Families programme, the FAST programme, which was in the accolades this morning. It's got a really strong evidence base. Support groups for looked after children and training programmes for foster carers, like the Confidence and Care programme that's about to be rolled out through Wales. We know much more about those kind of programmes than we do about routine social care services. Things are changing a bit very slowly in our culture of using evidence in UK social work. I'm just going to give you one very recent example of some research that's been carried out of statutory frontline social work. It's been carried out by Professor Donald Forrester, who some of you might remember carried out the original option 2 evaluation that provided the evidence that led to the integrated family support teams. He's recently carried out the largest ever, or so he tells me, the largest ever experimental study of UK casework with children and families. He's done that in Islington, and Islington don't mind being named. I did ask. It was with over 600 families who received services from that service. And they were randomised to receive services by a social worker who'd been specially trained in motivational interviewing, or those who just had the usual training. The good news, because the results are just out, they're not published yet, but he says if anyone wants to email him, he'll send you the results. It's Donald Forrester in Bedfordshire University. The good news was that those trained in motivational interviewing engaged families better and improved parental self-reported well-being. The more disappointing finding was that outcomes were no better for children served by the motivational interviewing trained group. The researchers in Islington, when they sat down to think about it, concluded that a process-driven organisational culture, obviously not just confined to Islington, diluted the effects of the training. And to be fair to Islington, they're now embarking on a major shift in organisational culture and how they work with families. The good news is that I'm happy to announce today that Professor Donald Forrester will be my replacement in heading up Cascade at Cardiff University. I think he brings a really strong research and evidence base to Wales, and I know he'll really look forward to engaging with all of you after he starts in January. There's also the new School of Social Care, headed up by Professor Judith Phillips of Swansea University. She was here right up until lunchtime today, and I know she'll want to really engage with you all about how we can improve evidence for what we do in social work. Anyway, back to those Islington findings and the difficulty of innovating within an entrenched culture. Under the new Act, we have a chance to really change the organisational culture of work with children and families in need of support to an outcomes rather than outputs one. I know some of you have already been working really hard on organisational culture issues for some time, thinking about your work really systemically, whether it's bringing in signs of safety or other sort of underlying philosophies to drive your work. I think the Act provides an impetus for everyone to consider new ways of conceiving what social work is and what it's trying to achieve. There's a brand new report by the Social Services Improvement Agency, actually, that's available online that reviews evidence-based frameworks for children's services. So that's also well worth a look at. I, for one, will be really excited if we start to see some really improved outcomes for our most vulnerable children and their families as the Act beds in. The final challenge under the Act that I want to talk about today, that I think is also a possible opportunity under the Act, is the issue of transition between child and adult services. This is not a new issue for any of you, I think, and lots of efforts have been made over the years to improve the transitions in some service areas. But young people and their parents or carers are still telling me that turning 18 can feel like reaching a cliff edge for some of the support that they rely on. I've only been in post for a few weeks, but this issue has already been brought up with me quite a number of times. My investigation and advice team have been contacted several times where young people have been told that the threshold for eligibility for adult social services support is higher than that for children's social services support, including sometimes being based on an IQ threshold rather than other vulnerable, that doesn't take into account all vulnerability factors. I really hope this won't be the case under the Act. In theory, under the Act, needs that have been recognised when a young person is 17 should still be recognised when they're 19 if they've not changed. We shouldn't expect things to change automatically the day they turn 18. I'll be following closely how the experience of being 18 and in need of social care services changes under the Act. And I've talked to the Minister and the civil servants about asking them about how they see what will change, and really saying that we need to all keep an eye on this, because it is really one of the most exciting possibilities actually for me under the Act, and it's an advantage of the people model, indeed. So to summarise, what are my questions to service providers on rights in children's social services under the Act, under the Sustainable Social Services Framework indeed. So just to summarise, my questions really for everyone, Welsh Government and local authorities, are: how will services involve children as citizens at an individual level and at the level of service planning and provision? Will we see more joined up planning and delivery for children and their families involving social services, education, health, housing and anti-poverty strategies? Can we shift a process-driven culture to deliver better outcomes for children and their families? And will young people approaching 18 experience a better transition to adult services? For the last bit of my talk, I want to talk about children's rights in Wales, which is obviously one of the big reasons for having my post, is to make sure that I'm keeping a close eye on where they are in Wales and beyond. So next week, myself and the other three UK children's commissioners will be publishing our report to the UN Committee on the Rights of the Child, on our analysis on where we're at with children's rights in the UK. It's the first time we've reported since 2008, so it's a significant moment for us. I'm going to give you a sneak preview today, a spoiler, as it were, of what we're going to be saying. I suspect there won't be many surprises for you, but there are things that to me are really, really important. When I'm considering human rights, I think it's important to think about it at three levels, actually. Do we have the structures in place In Wales, that might be things like, do we have an independent children's commissioner who's free to speak out on issues of children's rights? Do we have the UNCRC incorporated into our laws? The second level down is the process level, the outputs, as it were. How many youth councils and children care councils do we have in Wales, for example? How many consultations have been done directly with children and young people? Often when we think about rights and report on rights, that's where we end. We've got to think of the third level as well, which is outcomes. Has the process of incorporating children's rights into our services, into our laws, and into everything that we deliver, has it made a difference for children and young people, and have their rights been upheld? So when I'm analysing where we're at, I like to think about things on all those three levels. As you might expect, we'll be talking about pluses and minuses in the report. You might say 2 steps forward and 1 step back across the UK. So here's some of the pluses first. Since the last time we reported, Wales has brought in the rights measure, and that is, of course, a really fantastic step forward. I would love to see more of the local authorities formally signing up to due regard, to pay due regard of the UNCRC, as Swansea and Pembrokeshire have already done. If you are an elected member or a director here, please do go back to your local authority and say, where are we up to with signing up to UNCRC and saying that we'll pay due regard to it? I'd really like to see more local authorities signing up positively to that. I think it's important that we think about all of our UN obligations, absolutely. Family support. We have some good programmes, of course, and I do pay tribute to Flying Start and other work we're doing at social services level in Wales to help prevent children and young people getting into more extreme circumstances, trying to get help to them at an early stage. And of course, we have in general a pretty good participative culture in Wales that's built up over the last 15 years or so. There's some really thriving and active youth councils and youth-led activities. And we were the first and only, in fact, country to legislate for school councils. And I've met some really strong school councils. That's where I was when you were all listening to Karen yesterday. I was with a school councillor in a school, John Bright, and really knowledgeable and able young people who've really participating in their school. But there are gaps, of course, as you might imagine. And the headline for us next week is going to be poverty, and really challenging the UK government on austerity and on its impact on children. Within Wales, the underlying drivers for child poverty, of course, are at a UK level in terms of benefits, tax, and the settlement and the money that comes to Wales. But there are things that our national governments and our local governments can do too. So we all need to take some responsibility for thinking hard about child poverty. There are many good programmes in place, lots of good outputs. So thinking about structure, we've got a pretty strong child poverty strategy. We've got lots of good outputs in our anti-poverty programmes, but the outcomes for children are often still too stubbornly stuck in Wales, and we know our levels are really high here in Wales. The second gap is CAMHS. It's been systematically underfunded and understaffed right across the UK. The problems that have been highlighted in Wales this week are not unique to Wales, and the same issues of children's rights to receive a good service for their mental health and well-being is something that we're concerned about right across the UK. Within Wales, though, we have no dedicated minister for children. We have a minister who has children in her responsibility, but we no longer have a dedicated minister for children. The only country in the UK not to have one, actually. And no structure, no committee structure, as I've already indicated, for looking at children holistically across the government. On looked after children and care leavers, there are positives, of course, including the When I'm Ready scheme. But When I'm Ready doesn't extend to young people leaving residential care, who are amongst our most vulnerable children, of course, that we look after. We also still have too much instability in care, with too many children still having too many moves. On participation and democracy, the loss of a National Assembly for young people in Wales is a disappointment, and we need to work hard to find a new way of having a national platform for our young people to hold our government to account, to hold our Assembly to account, and indeed to hold me to account as their advocate. And I think for me, probably our most fundamental institutionalised breach of children's rights is that of what we call equal protection. The fact that we still legislate to allow children to be hit by their parents and carers. This is why I think it's the most fundamental breach of rights. When we legislate separately for children, in almost every circumstance, it's to give them more protection. So we say that children, young people can't drink alcohol or smoke until they're 18. We expect them to be in full-time education when they're still children, for example. The fact that we give parents and carers a defence for hitting children, but not for hitting their partner, for example, is the only age-based law I can think of that actively provides less protection to children than to adults. So this has got to change, and I'm determined to work hard with Welsh Government to find a way forward to change this anomaly in our law for children. Okay. I'm going to finish here. You're going to hear a lot more from me over the next 7 years. I've really appreciated having the opportunity to share my ideas with you. I hope you have had the opportunity to write down some ideas for me. I really can't do this on my own. I need all of your help and all of your ideas. And so there are so many hundreds of issues that have already been brought to my attention. I need to prioritise. In order to have any impact or effect, I'm going to have to prioritise and tackle the issues that most need tackling and that perhaps I'm able to tackle, or we are able to tackle collectively. In doing my work, I promise to notice and commend excellent practice as well as criticise weaknesses. I am, of course, a social worker by background, so I do promise to work in a strength-based way and to notice when you're doing well as to criticise. So please keep in touch. All my contact details are up here. And let's work together to promote children's rights to be safe and to lead full and happy lives. Diolch yn fawr.